Hello, this is Professor Marvel with a week one concept recording, an introduction to the concepts we're going to be covering in week one. I'm going to share my screen. Okay, I'm in the week one module here. Okay, so if you would take a moment to take a look at the course objectives for this particular week. Okay, contributing as a member of the healthcare team to healthcare activities to promote and maximize individual health and wellness. Okay. Another objective for this week is to identify common resources appropriate to meet the healthcare needs of selected individuals in a community-based setting in collaboration with the healthcare team. Another course objective to use the nursing process to apply your critical thinking skills and problem-solving skills in providing safe and effective care to individuals in the community setting that have common health concerns. Using your knowledge from nursing science and other fields to address the healthcare needs of individuals of various cultures and cultural and developmental stages in diverse healthcare environments, and then identify ethical and legal issues relevant to providing community-based care. So the weekly concepts for week one were introduction to community nursing, levels of healthcare prevention, Healthy People 2030, and then an introduction to vulnerability. So you had you had some book reading this week. You had chapter 1 from Fundamentals, your Fundamentals book, chapter 1, Nursing and Health in the Healthcare System. And then you had a page in the Med-Surg Nursing, your Community Care on page 123. Okay. Here you have your Healthy People 2030 website, which you need to go through. And then I want to give a brief overview of these Canvas courses. So let's start with our first concept to be covered, Introduction to Community Nursing. Okay. So one of the things we need to know the difference about is the difference between community-oriented nursing and community-based nursing. Okay. So community-oriented nursing, you're focusing on the entire community. Okay, you're looking at what the health assessment of what the healthcare needs are in the community. Okay, community-based nursing, you're focused on individualized care. That's the big difference. Okay, so as we talked about, well, we haven't talked about it yet, but one of the things that if you're community-based, you're working in the community. You may be a hospice nurse, school nurse, occupational nurse. Okay. Community-oriented, you're looking at the big picture. Okay. Community-oriented nursing is focused on health promotion and health maintenance for the whole community. Community-based is you're focusing on you're based in the community, you're focused on individualized care. Okay. So have a look at this. Have a look at this reading. It goes through what the duties of a community nurse are, the roles and responsibilities of a community nurse. Okay. When we talk about levels of prevention, okay, that's the second concept. We talk about primary, secondary, and tertiary. Okay, primary prevention, P is for primary. All right, we're talking about prevention of a problem, prevention of an injury, prevention of something before it even occurs. Okay. Examples would be talking about helmet safety, seatbelt safety, immunizations, prevention. You're trying to prevent something before it even occurs. Okay. And here in your reading, it gives you a good summary of each of them. Okay. So primary, you're trying to prevent the onset of a chronic disease by reducing risk factors. Okay. So think of all the things you would do to try and educate and prevent something before it happens. Secondary is essentially screening. Okay, we're screening for risk. Secondary prevention involves the detection and treatment of preclinical changes. Screenings is often the first step. Okay, then that leads to more cost-effective interventions. Okay, another way to look at secondary levels of prevention is early identification and early intervention. Okay, so you're screening for risk, preventing complications, attempting to reverse course. Okay, examples would be mammography, yearly blood pressure screening, pap smears. And then tertiary is the management. The important factor with a tertiary prevention is that they already have to have something. An injury has occurred, an accident has occurred, a diagnosis, a condition. Okay, so we're trying to manage the disease, okay, to reduce the symptoms and improve the quality of life. Okay, so if a school nurse is working with kids on making sure they take their medications, they're taking medications because they already have something, diagnosis, a condition, asthma, diabetes, seizures. Okay, the key with tertiaries, they have to have something already going on. Okay, so have a look at your reading page with regards to the levels of prevention. And the third concept we cover is Healthy People 2030. What is Healthy People 2030? Okay, I want you to focus specifically on their goals. Okay, so Healthy People 2030. Okay, these are national objectives to improve the health and well-being over the next decade for all people. Okay, these are very broad and ambitious goals, and they work towards and achieving a wide variety of more specific goals. So let's take a look at the 5 overarching goals of Healthy People 2030. Attain healthy, thriving lives and well-being free of preventable diseases, disability, injury, and premature death. Again, these are geared towards everybody. Eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being for all. Create social, physical, economic environments that promote attaining the full potential for health and well-being for all. Promote healthy development, healthy behaviors, and well-being across all life stages. And lastly, engage leadership, key constituents, and the public across multiple sectors to take action to help design policies that improve the health and well-being for all. So they are intended to improve the health and well-being for all citizens. Okay. One of the things that Healthy People 2030 talks about is social determinants of health. Okay. Social determinants of health are conditions in the environment where you're born, where you live, where you go to school, where you work, where you have recreation activities, worship, and age. All these affect the health and well-being of individuals in the community. Okay. There's 5 social determinants of health are grouped into 5 domains. And this is measured with every community. Okay. What is the economic stability of the community? Education access and quality, healthcare access and quality, the neighborhood that people live in, and then the social and community context. Okay, so things that are affected by these social determinants of health. Do people have safe housing, transportation, safe neighborhoods? Is there racism, discrimination, violence going on in your community? What does the education look like? Are there job opportunities? What is the income level? What is the poverty level in the community? Do people in the community have access to nutritious foods? Do they have physical activity opportunities? What is the environmental factors in the community? Is there air pollution? Is the water safe? Language and literacy skills. What does that look like? Are there parts of the population that don't speak the primary language? What are the literacy skills? What are the education levels? Okay. We know that social determinants of health also contribute to very wide disparities and inequities in communities, right? Example, people who don't have access to grocery stores with healthy foods are less likely to have good nutrition. And when you're less likely to have good nutrition, that raises the risk of health conditions, heart disease, diabetes, obesity, may even lower the life expectancy. Okay. Then the last concept is the introduction to vulnerability. Okay. Okay, there's lots of vulnerable populations in your communities. Okay. Kids are vulnerable, elderly's vulnerable, chronically ill clients are vulnerable, non-English speakers are vulnerable, veterans are vulnerable, people living in poverty are vulnerable. Okay. A lot of vulnerability are in our communities. This is a good reading page, a good summary of what is a vulnerable population in healthcare. We have vulnerable groups based on location. Okay. In a geographical community, maybe the entire population is not necessarily always vulnerable to adverse health outcomes, but portions of that community are. All right. There are some geographical communities, such as prisons, Native American reservations, in which all individuals are indeed vulnerable, whether they risk physical violence or exposure to infectious disease. Okay. Populations that may be involved or the result of war or natural disaster. We do have entire geographical populations that may be vulnerable to disease or death. Okay, then we talk about why kids are vulnerable, why the elderly is considered vulnerable, chronically ill, as we said, non-English speakers. Okay, this is a good section to read about what is the difference between at risk and actually vulnerable. Okay, so have a look at that. One of the things that we'll talk about in class is how to help the vulnerable populations. And a word that comes to mind is resiliency. Okay. We know that resiliency is influenced by early life experiences. The more resilient you are, the less likely you're going to be at risk. Okay, negative events in childhood that aren't dealt with through counseling or other approaches can decrease your resiliency. Higher levels of confidence that you have will increase your resiliency. Okay. We work with vulnerable populations a lot, and at-risk populations a lot with trying to increase their resiliency. Okay, and this will come up in the quiz and week 2. Okay, what effects do resiliency have on populations? Well, obviously, the more resilience you have, the less likely you are going to be at risk. The less resiliency you have puts you at greater risk. Another area of vulnerability for people in communities is with regards to vulnerability is insurance. You know, a lot of vulnerable populations are either not insured or underinsured, and that puts them also at great risk. If you don't have insurance or you're underinsured, you will likely have less access to health care. Okay, and that it puts you at risk. Okay, so remember that. Um, poverty. Poverty is very common amongst vulnerable populations, right? They contribute to wide disparities in care. That's where those social determinants of health come in, right? People live in poverty, often live in unsafe areas, work in stressful environments, have less access to healthy foods, exercise, and like I said, are more likely to be uninsured, underinsured, right? And going back to the insurance, people that are underinsured or have no insurance are much less likely to seek preventative care. Okay, and then they're going to suffer the consequences of preventable illnesses. And a lot of times you don't come into contact with these populations with insurance issues until they're in a crisis state or their disease is in a more active or chronic state. Okay. Outcomes of vulnerability. Without intervention, people are going to be sicker. There's going to be an increased morbidity or mortality rate, high prevalence of chronic diseases, high prevalence of communicable diseases such as TB, hepatitis, HIV, STDs. Okay, so our nursing interventions with the vulnerable populations, and we'll talk about this in more detail in class, should include strategies to increase resources, reduce health risks, and try and reduce health disparities. We'll get more in depth about vulnerable populations in class, but that is the overview for week 1. Thank you.